Well, thank you to you and everyone. The outreach has been absolutely amazing, and it's changing lives. Thank you so much. Well, here's what we all know. We are the biggest city in the richest nation on earth, and yet there are 600,000 people who do not have health care coverage. 600,000. I want to remind everyone that is the size of the entire population of Milwaukee or Baltimore. That's a whole city worth of people who don't have health care. And they don't know where to turn. They live in fear of something going wrong. And we know one thing for sure, they do not get the health care they need when they need it. That's that emergency room trap again. If they get health care, it's when it's already too late. That leads to emergency room visits, and that leads to hospitalizations that could have been avoided in the first place. Everyone loses then. Certainly the patient loses. When they didn't have primary care, when they didn't have specialists when they needed them, so they end up in the emergency room or they end up in the hospital when it could have been solved on the front end. That's bad by any measure. But I'll tell you something else, the taxpayer loses too. When all that money is spent, when it's too late, rather than a lot less being spent when it could make a bigger difference. We only can break through that problem by getting everyone covered. And I want to emphasize to everyone, this is a different mindset. I talked about this previously. You know, once we said to people that pre-K was for everyone, families knew they could depend on it, and they made their choices. They decided how they were going to approach things with that knowledge that it was universal. It helped people organize their lives, and it answered a lot of questions. You knew you weren't going to have to wonder. You knew you weren't going to get your child rejected from pre-K. A lot of parents, for years and years and years, tried to get their children to pre-K. There was no slot that worked for them. They got rejected. They had to come up with something else. They did something less good. Well, that's what 600,000 New Yorkers have been doing when it comes to health care. They couldn't find an insurance that worked for them, or they weren't eligible. So they did something less good, and they waited, and they got sick, and then they got sicker, and then they went to the emergency room. When every single New Yorker knows that health care is there for them, they will act differently. They will get help when they need help. They won't put it off. What Shaylin talked about is a great example. When you know it's there for you, you go to the doctor when you need it. And that will make us a healthier city. You know, every single person you stand next to in the subway, everyone you work with, you want them to be healthy for their sake and yours. Here's a way to actually achieve that goal, and it's in our reach. So I hasten to add, because I want it to be crystal clear, if you said to me, is the ideal to have Medicare for all at the federal level? Of course. That could happen tomorrow. That would be a game changer. Or single payer in Albany? Of course. I want to see those things happen. I believe we'll get to that day. But until that day comes, we have to take care of our own people. And we have to show cities and states around the country that it can be done right here on the ground. We have to push the spectrum. We have to show people that the notion of universal health care is living and alive and doable right here in the nation's biggest city. That's what we're going to do. Now, let's be really clear how we're going to proceed. Every single New Yorker who does not have coverage will get coverage under this plan. If you are like Shaylin and you are eligible, we are going to reach out to you. We're going to make it easier than ever to sign up. We're going to provide you with better care through Metro Plus than you've ever seen before. It is going to be 24/7 help available for you. When you have a problem, you will get to call a phone number, talk to a trained person who will tell you immediately where you can get the help you need right away. If you need primary care, you're going to have that option because you will be assigned a primary care doctor with a name, with an address, an actual human being who becomes your doctor all the time. When you need specialists, they'll be available. People haven't experienced this before, where there was a public option available that was high quality, that was in every part of the city, that was easy to use. This is going to be a game changer, and the more and more people we reach, the bigger difference it will make. So we got about 300,000 people who are eligible, but not signed up. Our goal in the next 6 months is to reach the first 30,000. There's going to be an intensive get covered effort a brand new wave of Get Covered NYC. This extraordinary group of dedicated professionals is going to go out, but we're going to also have, working with them for the first time, all of the people who work for the city and every day talk to their fellow New Yorkers. Imagine whenever a parent goes to their school, they're going to have an opportunity to sign up for health insurance if they're eligible and they don't have it. Think about the reach of our school system, 1.1 million children, all the family members that we can reach through them, all the 400,000 New Yorkers who live in public housing. We communicate with them every single day, but we've never communicated with them on the fact that they could sign up for health insurance. Every city agency, every agency that works on behalf of the people of New York City will become a part of it. So all the good people at Get Covered NYC are going to have a lot of new allies and a lot of help. So our goal by July is to sign up the first 30,000 who are now eligible but uninsured. Overall, we want to reach 300,000 people, and that effort will speed up as the city agencies become a part of this initiative. Now, I want to remind people that while we're promoting this option and showing people what an impact it can make, there are the other options available on the insurance exchange, and there's a lot of great choices for people who need them as well. But you only have till January 31st of this year for those options on the exchange. So I'm going to ask all our colleagues in the media, please include in your coverage that January 31st is the deadline to sign up for health insurance via the exchange. That's just 9 days from now. And it's a wide range of options. For those who are eligible and want choice, the best bet is to sign up in the next 9 days. But after that, there's no question of our ability to keep signing up people for Metro Plus. That's year-round. That's something we control right here in New York City. And that enrollment effort is going to begin immediately, and it's never going to stop. It's going to grow and grow and grow. So those are the immediate things we're going to do. Also want to remind people the NYC Care Initiative is starting soon, and that's focused as well on the folks who are not eligible, but they need health care just as much. There are 300,000 New Yorkers who work beside us, live beside us, contribute to this city. They happen to be undocumented. They're our neighbors. They deserve health care too. If they're healthy, we're all healthy. That's what NYC Care will do. Because again, if they are healthy, we are all healthy. It's going to make a huge difference. So everyone, if you want to know how to sign up, again, you heard Shaylin say how easy it is. Right away, Get Covered NYC. You can find it online. You can call 311. You heard what she said, 2 seconds to connect, and then a very quick process to sign up, and then right away, you've got a doctor. You're in business. You're going to do better. We are now going to take the formal step of instructing and ordering all city agencies to involve themselves in the outreach effort. I expect every single city agency, every agency that serves New Yorkers, to do their maximum to ensure that people are signed up for health insurance. This is everybody's business. This is a matter of commitment for all agencies to be a part of this effort. And to make sure that happens and that starts right away, I will sign an executive order instructing the agencies to act immediately. And here it is. There it is, everybody. You're all in business. We need you now. All city agencies will help us make sure every New Yorker has access to health care. Every single one. Are you ready for the mission? Yes. Are you ready for the mission? Yes. Okay. I believe you now. Okay. Whatever you do from this point on, if you go for a job training, a small business services, if you pay your taxes through the Department of Finance, if you pay a parking ticket, if you go and get assistance for your family, wherever you are, you will have the opportunity to sign up for health insurance. And I want to make clear that this is a very poignant moment to think about what we're doing here today. Because yesterday, we celebrated the holiday in honor of Martin Luther King, Jr. And I talked about yesterday the fact that he didn't just talk about civil rights. He talked about economic justice as well. And if you really look at his writings, his speeches, everything he was talking about, it went a lot deeper than sometimes you hear at the various commemorations. Here is a quote that says it all about what we're doing here today, because Dr. King understood that health care was a human right. He said, "Of all the forms of inequality, injustice in health care is the most shocking and inhuman." Those were the words of Dr. Martin Luther King, Jr. The most shocking and inhuman. And yet it's been tolerated for too long in this country. Here in New York City, we are heeding Dr. King's words, and we are going to make a difference right here in our city. A few quick words in Spanish. Estamos trabajando para que todos los neoyorquinos tengan cobertura, sin importar su estatus migratorio o capacidad de pago. Con la orden ejecutiva de hoy, todas las agencias de la ciudad deben informar a los neoyorquinos sobre las opciones de cobertura. La atención médica es un derecho humano. Llaman al 311 y piden que les conecten con Seguro NYC. Gracias. Someone's going to do it right away. I like that. All right, and now one of the masterminds of this great new plan, and I want to thank her for her leadership, our Deputy Mayor, Dr. Herminia Palacio.
Good morning.
Good morning.
Thank you so much, Mr. Mayor, for the introduction and for your incredible commitment to bringing health justice to New York City. Thank you, Shaylin, for sharing your story enthusiastically and for saying how important it is and how easy it is. Thank you, Kings County and all of Health and Hospitals, and Dr. Katz, my partner in crime. 2 weeks ago, you heard the mayor announce NYC Care to help New Yorkers without insurance access quality, affordable care. And as you've just heard today, we are not letting up. This is a march towards health justice. The executive order that he just signed, we're taking another step in this march. The executive order, as you've heard, will require all city agencies that interact with New Yorkers to provide them information about affordable health insurance. People will be connected with Get Covered. The order will impact all health and human services agencies, but other agencies that you don't think about necessarily for health, like the Small Businesses Services, Department of Finance, PUCs. You may encounter information about health insurance options when you walk into the Office of Workforce Development for job placement training. You may encounter it when you visit the Department of Finance business centers to pay property taxes, or you're simply attending parks programs for your diversion and your health. As a physician, more importantly, as a primary care doctor, nothing makes me happier. We have talked about the importance of primary care. Often people think about that in terms of the science of medicine. Let us not forget that a primary care doctor brings you the art of medicine. A primary care doctor brings you compassionate, holistic care. A primary care doctor engages with you in a dialogue, not just that one day, but sometimes over years, sometimes over a lifetime. A primary care doctor listens to you, gets to understand you, and I have to say, as somebody who practiced for a long time, a primary care doctor is happy to see you. It's happy to see you, like as a human being. So getting a primary care doctor is about making sure that you get things like preventative care. It is about being able to go somebody when you have a sore throat or a cold. But it's also knowing that when you go with a concern, sometimes the most intimate of concerns that you have a trusted ear who's listening to you, a trusted hand you can hold as you're facing sometimes very scary things. So, effective immediately with this executive order, the Public Engagement Unit, which oversees Get Covered NYC, will work in coordination with my office and city agencies to implement this new requirement. They'll be ensuring that agencies have all the resources they need to communicate with people who need insurance. They will be training frontline staff. The executive order will increase our outreach efforts, reminding people that the city's public health option, Metro Plus, is here for them. No greater testimony than Shaylin's testimony today. We will be doubling down on the existing efforts referring the uninsured to enrollment insurance, but our goal is to find new opportunities, new ways to spread the word, new ways to reach out, new ways to find you where you are and get you the care that you need. We want to be all doors and all windows into Metro Plus and healthcare insurance. New Yorkers have the right to health care, and they have options. We urge New Yorkers without health insurance to get in touch with Get Covered NYC before January 1st for the state's open enrollment period. But this work is not going to end for us in 9 days, as you heard the mayor said. We will be enrolling ongoing. Seniors, low-income New Yorkers can enroll year-round. Anybody who has an event such as getting married or changing jobs or having a child or adopting a child, those are all events that qualify you to enroll even after the open enrollment period. We know that navigating some of these health insurance options can be daunting, it can be confusing, but that's why we're here with Get Covered NYC, people who can help you connect. Because as you heard, we believe that healthcare is a human right. So if someone in your life needs health insurance, call 311 or visit nyc.gov/getcoverednyc. And now I will say a few words in Spanish as well.
Show off.
El acceso a servicios de salud es un derecho, no es un privilegio. La ciudad está haciendo todo lo necesario para asegurar que los neoyorquinos sepan que hay opciones de seguro de salud gratis o de muy bajo costo. De ahora en adelante, todas las agencias de la ciudad ofrecerán información sobre cómo obtener seguro médico. La fecha límite para inscribirse es el 31 de enero. Quedan 9 días más. Si no tiene seguro médico, llama hoy mismo al 311 o visite la página web nyc.gov/getcovered. Pero aún después del día 31 de enero, nosotros estamos aquí para ayudarle, especialmente hay opciones de Metro Plus, de bajo costo, para muchas personas que no tienen mucho sueldo. Así que le agradezco mucho su atención y le deseo un año 2019 con mucha salud. A healthy, happy 2009 for everyone.
Amen.
19.
They had 2009 already. Let's give them 2019. So there are elected officials who bring extraordinary experience to their work, and Councilmember Matthew Eugene not only represents this community and this wonderful facility, but he has been a healthcare professional throughout his life, and he has made it his life's mission to help people who are underserved and a lot of folks who didn't have the help and the access they needed. So I know he brings a special perspective to this. Councilmember Matthew Eugene. Thank you.
Thank you very much, Mr. Mayor. It is, as you know, my name is Matthew Eugene, the New York City Council member representing District 40. That means the district where you are at right now. I think you understand how privileged, how happy I am to join the mayor for this very, very important rally. And I'm grateful to the mayor for everything that he has been doing, he's doing for the hardworking people in New York City. And I'm also grateful to the mayor for a very special reason, for choosing this very place, Kings County Hospital, a great institution where people, dedicated doctors, nurses, medical professionals, are working hard every single day to keep our New Yorkers healthy. And I want to take the opportunity also to commend and to thank the leadership, the CEO of King County Hospital. Thank you very much. Thank you. You know, as the chair of the Civil and Human Rights, I love when the mayor said health is a human right issue. It is. It is a human right issue. It is not a privilege. And I think also this is the responsibility of the government to do everything possible for the people to get access to the highest quality of health. This is exactly what the mayor is doing today, assuming the responsibility of the government, reach that goal and fulfill this responsibility of the government to offer medical care and medical coverage to everybody. Let's put our hands together for him, please. One of the things that I want to say, it is important for the government to provide access to medical care to the people, but it is a benefit, it's a win-win situation, because the people who are going to get access to medical care, they are the people who work very hard to make New York City such a great city. We need them. And they work hard also to sustain their families. If they are sick, this is going to be a big burden for the government and for my friend and my brother, the mayor, because we will have to maintain their families and to spend more money than if they had the medical coverage. One of the things that I want to mention also, we public servants who are members or are serving in different city agencies, we know that in the city of New York, there are very great and important programs, useful programs. But the problem is, not everybody takes advantage of that, even when they are qualified. You know why? Some of the time, they don't know. Some of the time, they are busy. Some of the time, they don't see the importance of those great programs. But I'm so happy that the mayor came with an innovative concept, a new concept to register people to medical health insurance. He's going to them. The mayor said that we are not going to let them come, we are going to them. We are going to involve everybody to ensure that the people know when they have to register, what they have to do, and the importance of getting medical coverage. This is something remarkable that is happening right now. And let me tell you, myself also, as a strong advocate for health, I pledge to continue to work together with the mayor to make sure that everybody in my district registered for medical coverage, New York City Health. And let me conclude by saying that some people may say, why cover? Why should we cover those people who are not legal, who don't have immigration, status? It is important. If we don't do it, we are going to have problems too. And the mayor said it eloquently. If they are healthy, we are healthy. My brothers and sisters, Mr. Mayor, thank you for giving me the opportunity to say some few words, because I keep saying every single day, and the people at Kings County can say, health is the most precious gift that we receive from God. Amen. And we got to do everything to preserve it. And I want to conclude by thanking the mayor for doing everything possible to preserve this beautiful and precious gift that we receive from God. Thank you very much, and God bless you.
Thank you, Dr. Eugene. The fact is that elected officials are going to play a very important role in this. And I want to thank you for amplifying that, because a lot of people go to elected official offices. It's one of the places where they can get this kind of information. And I know a lot of the current generation of council members and legislators are very activist in their approach and do a lot of outreach efforts, and they're going to be a big part of this. So thank you very, very much. I want to hear from one more very important voice, because we are proud to be reaching 300,000 New Yorkers who happen to be undocumented. And one of the strongest voices of support for this initiative has come from the New York Immigration Coalition. I want to introduce the Chief of Staff for the New York Immigration Coalition, Gigi Gazan.
Well, so we know at a time that when immigrants and healthcare are under attack by the federal government, Mayor de Blasio is stepping up to the plate once again by signing this executive order expanding the work of Get Covered NYC and expanding the work that they're already doing to help New Yorkers enroll in insurance. And when we say that when immigrants are under attack and we stand up and we fight back, it's not just the fight in the streets and marching in the Supreme Court. It's the inclusive fight. It's the protective fight. It's the inoculation of our communities, because immigrants are part of the fabric of this community. And we look forward to our continued work with the mayor on landmark initiatives such as this, and as was mentioned, New York City Care, which will begin guaranteeing health care to every New York City resident, regardless of status or ability to pay. These initiatives have the potential to make all New Yorkers, all of us, healthier, stronger, more vibrant. And we'd like to thank the mayor, Dr. Mitch Katz, New York City Health and Hospitals, whose work to ensure access to quality health care is so important and essential to the well-being of all New Yorkers. Y en español les voy a decir que como hija de inmigrantes que teníamos miedo de ir al doctor, esto es un paso muy importante para protegernos a todos, para incluirnos a todos, para protegernos como comunidad y como familia y como neoyorquinos. Sí se puede, y en solidaridad, thank you to the mayor and thank you all.
Well done. Strong in both languages. Thank you. Okay, so we're going to first take questions from the media on this announcement today, and then we're going to take a quick break so all these good folks can get back to other important things. But first, let's take media questions on this. Gloria.
Mr. Mayor, January 31st deadline, what does that really mean? What happens on January 31st, and is anything going to change?
Yeah, January 3rd, I'll start as the layman, and then Armenia can jump in with more expertise. In terms of what the exchange does, look, I'm a big believer in the Affordable Care Act. I'd like to see us go a lot farther than the Affordable Care Act, but one of the very good things that it has done is given people choice that they didn't have before, and the exchange is the vehicle through which you get to choose among available health insurance plans. That window goes till January 31st. So if someone is uninsured and they want the most consumer choice, get online, look at what's available. If you find one that works for you, go take it. After that, though, we're quite clear about the fact that we keep going, because there's a huge number of people who qualify for Metro Plus, and we're going to keep going year-round. to get them signed up. So I would say the simple way to interpret to people is you have the most choices up until January 31st, until the next enrollment period, which I think is November, you said? But so you want to maximize those choices, jump now, you have 9 whole days. But after that, we're going to be here, and we're going to keep signing up a huge number of people.
So you're just referring to the regular health.
Correct, correct. But I think part of the issue, and you've probably watched this, is clearly the Trump administration has tried to discourage people from signing up. They've taken away a lot of the promotional efforts. They've suggested that Obamacare wouldn't be there in the future. There was obviously a court decision, but that's been stayed. We want to make it loud and clear to all New Yorkers that the Affordable Care Act is alive and well, and you can sign up until January 31st on the exchange. But then we're going to keep going after that with the tools we have. Any questions on this? Yes, please.
I'm just curious, since why needed to sign an executive order? This is just sort of an initiative to other agencies to publicize the city.
No, it's much more than publicize. I appreciate the question. They have to be active participants in signing people up. This will now be an obligation to use time and energy to make sure people are signed up for health insurance who qualify and don't have it. And when we have done that, we did that obviously with pre-K and 3K. It had a huge impact. These good folks from Get Covered have done amazing things, and this is again the difference. Before the Get Covered initiative, a huge number of people who were eligible and could have gotten insurance were not getting it. This team and all of their partners around the city have signed up 130,000 people in the last 2 years because there was a targeted outreach effort. Let's do that again. 130,000 New Yorkers got signed up. Let's give them a round of applause. Thank you. And that was because there was a targeted effort, but that was not every city agency treating this as a priority and putting real time and energy and focus into it. So now it is a formal instruction and direction to all agencies that this is now part of their mission too.
If I can just
Please.
Will there be data that shows the Department of Sanitation signed up? Are they required to signed up? NYPD signed up 50 people. And how would it look for like an agency like PSY and NYPD?
Sure. One, this initiates the action today with the executive order. I agree 100%. Every agency will determine goals according to how much they interrelate with people and what their circumstances are. Obviously, an agency dealing with security has other issues that will come into play. But let's take obvious ones like Department of Education, where there's a huge amount of connection with families, and that opportunity is not being tapped right now. I think there's a lot of other ones like that, as you heard previously. So we will figure out what each agency, what they can do, and then we'll work with them to have real goals, and I'm very comfortable with saying we'll publish what each of them did on a regular basis because we want it to work. The initial goal is to add 30,000 more, so 1/10 of our overall goal by July. But again, the agencies will just be ramping up during that period. A lot of that will be Get Covered, obviously. But as the agencies get more and more engaged, that number can continue to grow. So, yes?
Is there anybody from Metro Plus here?
Is there anybody from Metro Plus here? I guess there are people from Metro Plus here.
Who runs it, and could they tell us how many people are currently signed up? And when you say you're going to sign up 30,000 people in 6 months, does that mean 30,000 policyholders? Or for instance, I have health insurance, I have 3 kids.
Right.
There's 4 of us. So am I one under your goal, or are we 4?
Let me just answer that one last question before you. If you signed up today, you would be covered, your children would be covered, and your new beard would be covered. You went right by that.
So there are currently about 520,000 people enrolled in Metro Plus. The 30,000 goal is really Get Covered enrolls through the exchange and Metro Plus. That's sort of the overall universe. Really, our goal is to make sure New Yorkers have an insurance plan. We want to make sure that people know that Metro Plus is a public option. I want to go back to something that the mayor said. after January 31st. We will continue to enroll in the Metro Plus Essential Plan. It's important that people understand that the premiums are on average about $20 a month and can go down to zero. So it's really important for people to understand this is a very affordable plan. The Essential Plan and Metro Plus you can enroll throughout the year, but as the mayor said, if you want on the exchange, the New York State Exchange, which has lots of the private insurers as well, that that enrollment needs to be completed by January 31st.
Other questions? Last call, media questions, yes.
I guess just to go back to the executive order, I'm still pretty confused about why it's necessary since you are already kind of, in charge of all these city agencies. Like, why does it have to be in the form of an executive?
When you do an executive order, it ensures that the instruction is followed up on. It's as simple as that. These are agencies with a lot to do. I think everyone here would testify to that fact. They've got plenty of important work to do. We're saying this is now a priority mission for all city agencies, that we need everyone covered, that it will have huge positive impacts for the city, and it's part of their work plan now. So the executive order makes very clear this is not an option. This is now a priority for all agencies. Yes?
And again, this might be too in the weeds for something that you just signed, but what will count as signing someone up? Will it be a teacher saying, oh, hey, your mom should sign up, and then actually going through the motions with a parent at a school? Would that count towards it?
A sign-up is a sign-up. It has to result in people getting insurance.
So it's not just referring, and if that's counted, if that's being given to the different agencies, then what does the Get Covered team do?
They've got plenty to do because there's plenty of New Yorkers who don't interact with a government agency in a way that would be conducive to being educated on health insurance or signing up for health insurance. What they've been doing brilliantly is they go everywhere. They go to community events. They go any place where people are. Famously, one of the things that happened with Get Covered and with the Pre-K and 3K initiative is going to barbershops and beauty salons, community events, local street fairs, block associations, you name it, wherever people are. And it's proven to be extraordinarily effective. Getting people in their community when they have time to actually think about something is a big piece of the puzzle. But we also know that the agencies really reach a lot of people, and different people a lot of times, and we need literally to grab every opportunity to get people signed up. But we're only going to count towards this number if someone actually has coverage. See if there's anything else on this. Go ahead, Rich.
Do you sign people up at bus stops? Because that's one of the few places where New Yorkers can't run away from.
I like that. You're a visionary. I know, I think that's right. I'll do a survey of team bus stops. I would also say subway platforms where you have a captive audience. Bus stops, subway platforms, do you do that?
Subway platforms.
Subway platforms for sure. We're going to start doing bus stops now. Yes, we are doing bus stops. Last call. Okay, let's give these folks a chance to go on to their good works. Thank you, everybody. back. Come on. We got to clear it out. Okay, here we go. We are going to take questions on other topics. Yes, sir.
The Supreme Court is going to take up a case involving your city government. I think this just happened this morning. I saw this. The law, as I understand it, has to do with being able to carry firearms outside the city limits. You can't transport firearms out of state and go into remote range. The Supreme Court's going to take this up a bit of a challenge. I don't know if you have any thoughts on this and what would be state and Supreme Court to take up the city government.
I'm just hearing this now from you, so I'm simply going to say we believe that our gun laws protect people in this city, and law enforcement in this city believes that too. So we'll fight vigorously to protect what we have. That, you know, we every single day are working to make this the safest big city in America. We need the laws we have that protect against guns being on our streets, and we will fight to protect those laws. That's the bottom line.
Details, would you be concerned about the Supreme Court deciding on city government given the new makeup of the court?
I'm absolutely concerned because, again, anything that takes away our right to protect our own people would hurt this city deeply. We're the safest big city in America for a reason, and the laws we have now are working. And I know how deeply Commissioner O'Neill believes that. So we will fight to protect them. But to give you any more detail, I'd have to see the current state of play. Yes?
Mayor, this afternoon, the State Assembly considered a vote on the Reproductive Care Act. Cardinal Dolan has come out with a statement already, assuming that it's going to be approved and signed by the governor this afternoon. And he talks about that abortion will be enshrined as a state law, a state right, up until the time of a child's birth. Is that the way that you see the law? And also, what do you tell people who see this as morally objectionable?
I support this act. It's crucial that we protect a woman's right to choose, particularly at this moment in history where women's rights are under attack. Clearly, we need to do everything we can to help people avoid unwanted pregnancies, and that's why things like Planned Parenthood are so important. I believe this is a right policy, but I also believe it's incumbent upon us to educate people, to make sure that birth control services are available widely, to do everything we can to help make sure that people only end up with the situations that they want. But yes, this act is necessary. Go ahead.
Mr. Mayor, this is show and tell day here.
Show and tell day, I didn't know that.
I have in my hand some videos that show homeless people taking over subways during the fall. Not only sleeping on benches when they take up 2 or 3 seats, but also in one case, a woman moving all of her goods, taking up half of the car with all of her goods. People saying, what will the mayor do about it?
Well, Marcia, it's an unacceptable situation. You know, in this city, and I would like you to report on this too, there were encampments, full-blown encampments for decades under my predecessors, where there were full structures, there were mattresses, there were homeless people living in villages, and nothing was done about it. During this administration, we ended that once and for all. Any attempt to create any kind of structure is immediately addressed by the police department and homeless services and the sanitation department. I would like you to take a look at that situation because it will give you a window onto what we're going to do in the subways as well. We will not tolerate people bringing a vast amounts of belonging into a subway car. We won't tolerate people sleeping on the benches and stretching out and making it impossible for other people to ride in peace. We have the tools to act on it. And I've spoken to Commissioner O'Neill about this, and you're going to see consistent police presence dealing with that problem.
Ask the police department to move people, to ticket the people, wanting them to bring their stuff off the subway.
The first thing is to address the problem. If someone is lying out on a bench, we want them to stop doing that and to conform with the law. If they refuse, we have the opportunity to take them out of the subways, and depending on the circumstance, there obviously is the potential for arrest. But our goal is not arrest. Our goal is to address the problem. On the belongings, no one can put their belongings in a place that obstructs other New Yorkers. So that's going to have to be a judgment call on behalf of our police officers and our outreach workers from the Department of Homeless Services. But we have addressed this problem above ground, and we're going to address it below ground as well. And I got to take other questions. Go ahead. Go ahead, Marcia. I'll be back to you. Go ahead.
Tom Snyder was your chief of staff before Kevin O'Brien. Similar to O'Brien's departure, there was no public announcements that Snyder was leaving. You made no public statement thanking him or acknowledging his service. Why did Snyder leave? Were there any allegations of any sort, either formal or not, against him involving any kind of misbehavior or wrongdoing?
No, there were not at all, and it was simply a decision together that it was time for a change. Yes?
Mayor, I want to ask you about the city's plan to acquire some cluster site housing apartments to turn over. You know, there was discussion of, I guess the city was looking to finance some of these properties. We're now involved in the federal investigation. Your administration said last week that was now on pause. Curious why it took the investigation to pause that, given their history. They've been, you know, kind of known as bad landlords in the past, and also have faced criminal charges before. So just wanted to kind of get your reaction to the investigation, and also why the city was pursuing a deal that, you know, could net them a good amount of money.
So I'll start, and Commissioner Banks can give a little more insight. First of all, we are not going to take, with all due respect to the media, we're not going to take media reports wholesale when it comes to the question of investigation. We're going to ask the investigatory agencies what exactly is going on. Because we're in the middle of trying to take these buildings and turn them into permanent affordable housing that would no longer involve that family. And that is obviously in everyone's interest. So we have a pause, that is for sure. But until we confirm what is happening, we're not going to prejudge the situation. Our goal is still to turn that into permanent affordable housing as quickly as possible.
Is eminent domain still on back on the table for that side?
Eminent domain is always an option in a situation like this, but Commissioner Banks can speak to it.
Thank you. Eminent domain has always been a tool that is available to us. I just, want to make sure that everyone understands these buildings have been used by the city during prior administrations for many years, and our initiative is to stop this 18-year-old cluster program. We're out of half the cluster units already, and we think it's an important public purpose to convert units that were used as cluster apartments into permanent housing for homeless families. One way to do that is to have use the eminent domain tool. Another way to do that is to reach a out-of-court resolution without going the eminent domain route. But this is certainly a goal that we have to make sure that families with children are in permanent housing as opposed to these cluster apartments that have been used for the last 18 years.
Yeah.
Can I follow up? I know you don't want to take media reports wholesale, but an associate with Tommy was actually in prison right now for tax issues. He's involved in this, so it's not just media reports. I mean, what do you guys look at? A lot of these are owned by LLCs. What do you guys look into still these kind of LLCs owning? I mean, how much?
No, it's a very good question. So, of course, anytime we get new information, we're going to do our due diligence. But I want to caution, I don't know this family, I don't know the history of this family, but I don't know if the gentleman who's in prison has anything to do with what we're talking about here or not. What we have is a report of investigations. We are literally going to go on a very formal level and ask the agencies that might be involved, do you have an active investigation? If you do, then we have to coordinate before we take another action. The important underlying fact here is it is in the public interest to get these buildings under public control. So if there is an investigation that causes us to have to pause for an extended period of time, so be it. But if there is not, or the investigatory agency says, no, please continue with your arrangement, we want to see this transaction occur, we will move full speed ahead. Yeah.
But did it concern the city at all? I mean, I understand you don't want to keep reports of the current investigation at wholesale, but these landlords have previously pleaded guilty to crimes in 1986 to coercion and to grand larceny and forcing people out of their apartments.
I don't belittle any negative action by a landlord. As you know, we are increasingly cracking down on bad landlords. I do want to say 1986 was quite a while ago. We're talking about today. I don't know who the cast of characters is, if it's the same in details or not. What I care about is getting these buildings under public control. I want to get to that as quickly as possible, but why don't you speak to the history there?
I would just add to the mayor's comments. Those guilty pleas occurred in the 1980s. The city began the cluster program in 2001, and consistently 2001 through 2009, 2010 began to use these buildings. And the aim of this new initiative that we announced is to reclaim these units to be affordable housing for low-income families who are in the shelter system, and to keep them in that permanent, affordable basis. But it's important to sort of look at the sequence of events. And the pleas took place in the mid-1980s, and the city began renting these buildings beginning in 2001 as part of this 18-year-old program. We're saying we want to end this program. We've already gotten out of half the units citywide, and acquiring these buildings either through eminent domain or out of court is part of a strategy of reclaiming these buildings for permanent affordable housing to be managed by not-for-profits. Remember, that's what the transaction is, to finance not-for-profits to purchase these buildings and make sure that they will be permanently affordable for the permanent tenants that were in these buildings, as well as converting the units that were clusters into permanent apartments for homeless families.
Marsha.
What exactly about the police to deal with the
Sure. Because we're talking about the MTA, there's a different set of rules than above ground, and there are specific activities that are not allowed. We want the police to enforce those rules clearly. We also want to get people out of the subways, off the streets, once and for all. Now, I want to give credit to Commissioner Banks and his whole team and everyone who's been part of the Homestead Initiative. Again, one that I would urge you all to look at and talk about a little bit more. 2,000 people who were street homeless, permanently homeless, in the last 2 years were brought in off the street through a really extensive, doesn't even begin to explain it, the most extensive homeless outreach effort in the history of the country. Literally, Marsha, if it meant going to a homeless individual on the street 100 times, 200 times to win their trust and convince them to come off the street, you should look at the specific stories. I'm sure Steve will provide them to you. They're unbelievable. People on the street 10 years, 15 years, came in, got mental health treatment or substance abuse treatment, and stayed off the streets and never went back. That's what's been happening for the last 2 years, so that's a huge difference maker. The goal, of course, if someone's there in the subway car and they're making life difficult for their fellow New Yorkers, we want to get them out of that subway car, but we don't want them to just take the problem upstairs and be on the street. We want to get them off the street once and for all. So that's the goal. But clearly, I believe fundamentally, and I know Commissioner O'Neill does too, that the NYPD has a right to enforce the laws of the MTA, the rules of the MTA, and if someone is doing something inappropriate in the subway, we'll get them out of there. It's as simple as that. Yes?
So, Mayor, I wanted to ask you about the heat and hot water outages in NYCHA over the weekend, particularly yesterday. Just your response to between, I think, 5,000 and 7,000 or thereabouts, but also the HUD Regional Administrator, Lynn Tatton. You know, the administration's response was we're getting these back online quicker than we did last year, and her response was people should not be grateful because their heat and hot water is turned back on faster than before. These are basic human conditions. So wondering if if you could respond to that.
Sure. I checked in with the NYCHA general manager, Vito Mastacciolo, just before 5 o'clock on Sunday, as it was about to get very, very cold. At that moment, there were no developments with larger heat outages. I mean, maybe there have been individual apartments, but no full buildings or developments. By the time we got into Monday, there were 4, and we care about every single one. Well, our job is to not have anybody go without heat or hot water, and in the event it happens, to restore it as quickly as humanly possible. We believe, to Lynn Patton's point, I would say amen. We believe that public housing residents deserve the same exact lifestyle and support that people in private housing deserve. But I want to now tell you the facts. There were 4 outages, 4, from Sunday evening into Monday. The average time for the outage to be resolved was 9 hours among the 4. That's even faster than the number we told you about a month or more ago when we were saying 11 hours was our average. It's now down to 9 hours in these cases. That is a very fast turnaround when there's an outage, and thankfully the buildings do retain heat pretty well, so people hopefully have very little impact from such a brief outage. Now, I want to give you the same number for private housing in New York City yesterday. It was over 3,000 calls for heat being out made to 311. So I do think we have to look at what's happening here. If we had 3,000 buildings in New York City with heat out yesterday that were private buildings, we had 4 NYCHA developments with a problem. They were resolved on average in 9 hours. That is clearly progress, but we've got more to do. We've definitely got more to do. Okay, last call. Yes. Yes.
Congresswoman Ocasio-Cortez was on the Colbert Show last night. She was asked how much concerns her that she has gotten some pushback from rank about that, and she said she did not give any facts. I wondered if you have a reaction to that response and if you think anything about it.
I'm not worried about that. It's language we all use. It probably is best not to use it in public, but it's language we all use. No, the bottom line here is not her colorful language. It's what she values. I have a lot of respect for her. I agree with her on a whole lot of things, and I think she's a leader that is saying things that we need to pay attention to in terms of the kind of changes we need. So, no, that's not what concerns me. What concerns me is her values, and I agree with her values.
What do you think of her call to primary?
Well, I think you should be careful, respectfully, on that one. I mean, I haven't seen that quote from her. I have seen organizations that she has a relationship with call for that. So I want to be careful that we only hold her accountable for her own words. But I would also say, as a broader rule, our party needs to change. I've been pretty clear about that. It is moving in a more progressive direction. It has to keep moving in a more progressive direction. It's the only way we will change things in this country. It's the only way we're going to win elections. So I'm not uncomfortable with the notion of primaries. I think primaries can often be healthy because they represent honest values being debated. Yes?
Are you wearing longies these days?
That's awfully personal. But no, my very hardy New England background makes me impervious to this weather, so no, I have not been. Like the New England Patriots, I might add, very good in cold weather environments. Just have to share that. I always root for the Patriots.
Your thoughts on the game?
I was, it's superhuman at this point. It's just Tom Brady. It's superhuman. It's no, I'm a Patriots fan. I've been a Patriots fan since I was a little kid when they totally sucked and they could not win anything. And now Gloria's going to say I used a bad word. I am a lifelong Patriots fan. I'm proud of it. I've always been clear about it. And on the final drive on Sunday, to see Tom Brady wave off the timeout, I was like in heaven. I mean, that was just... I did, and when he waved off the timeout, I thought that was a beautiful, that was confidence, that was leadership, telling his whole team, we can do this, we don't even need the timeout. Unbelievable. Good things ahead, that's my prediction. I would never engage myself in the betting enterprise, Marcia, but LA is a formidable team, but I think what you just saw from the New England Patriots tells you everything you need to know about the Super Bowl. Thank you, everyone. Poor Eric. You guys are rough.